My name is Nurse Ashley. I work with Dr. Slaughter, and I'm here to discuss your diagnosis, your medication, treatment plan, and answer any questions or concerns that you may have. Okay. So you were diagnosed with a pituitary tumor. What do you know about the pituitary glands?
Not much.
Okay. So the pituitary gland is a pea-sized gland at the base of your brain, located behind your eyes. Um, It regulates, it's basically the central control center for your body's hormonal system. Um, Controls other endocrinology glands, such as your thyroid, which you have a history of hypothyroidism and Hashimoto's, adrenal glands, your ovaries, um, and secrete hormones for growth, metabolism, reproduction, the stress response, and water balance for your body. Um, Helps keep your body in homeostasis. And so so on the MRI, they found a 1.8 centimeter tumor on your pituitary glands. Yes. Um, so that does not sound very big, but the pituitary gland is small in itself. And your brain is a complex organ. There's not a whole lot of room in there. So that tiny little tumor is causing a lot of problems. So, for example, your headaches. The
Yes.
headaches that have been worsening over 9 months, um, that your pituitary gland can be responsible for that, as well as the blurred peripheral vision. Per the MRI, the pituitary tumor is affecting your optic chiasm, which is this X-shaped structure where your optic nerves come together from your eyes. So does that make sense why you're having peripheral vision problems?
Oddly enough.
Okay. Okay. Um, so with all that, do you have any questions for me?
What is their next course of action?
Okay, so we will be starting you on this medication. It's called cabergoline. You're going to be taking 0.25 milligrams twice a week. This is a starter dose, this is the base dose we start everybody out. Now, this is a prolactin inhibitor. Um, your lab results shown you have elevated prolactin or prolactinemia, which explains your leaky breast, the discharge from your breast. Yes.
It is quite discomforting.
Yes, I imagine. It also could explain maybe why you have some issues with your thyroid. You've been on levothyroxine for some time, the 75 micrograms. So, what we are going to do, you're going to start this medication. It has been sent to your pharmacy already. You're going to take it twice a week. Pick the same days every week to take this medication. We will see you back every 6 to 8 weeks. We will recheck your hormone levels as well as your thyroid levels to see how your thyroid's reacting. If the medication helps shrink the pituitary tumor, this may have an effect on your thyroid issues as well. Um, After about 12 weeks of being on the cabergoline, we are going to do a repeat MRI. And we want to do this to see if the pituitary tumor in itself is shrinking. And I want you to know that most pituitary tumors are non-cancerous. There is a very, very small chance that a pituitary tumor is cancerous. So, and way to we know that it's not cancerous is if it shrinks. Another way with the blood work, we can check your growth factor. And if this level goes down, it will also show that the pituitary tumor itself is getting smaller, which is our goal. Um, so we're going to continue to monitor your hormones, your reproductive hormones as well. Um, and then progesterone, uh, progesterone, estrogen. If with the shrinking of this tumor, if you have any issues with the leaky breast and your irregular periods, then we may consider estrogen progesterone replacement therapy. Um, let me look through my notes. Um, Now, if the slight chance that the treatment doesn't work, we still have room to increase the cabergoline. We can do up to 1 milligram twice a week. Right now, you would be on a fourth of a milligram twice a week. So there's still room there to move up if we need to. But in the chance it doesn't go down, it gets larger, then we would reevaluate and consider radiation therapy or surgical removal. Um, but that is rare. So, do you have any further questions for me?
No, I don't think so.
Okay, very well. Like I said, the medication has been sent. You're going to continue your levothyroxine dose of 75 micrograms once a day right now. And we will keep monitoring your TSH and free T4. Those are what we check with your blood for your thyroid levels. And if those fluctuate, then we may have to change your levothyroxine dose. But yeah, if you don't have any further questions, I can go ahead and schedule you for your follow-up appointment in 8 weeks, and I will give you lab orders to complete, like, a few days before you come back. Any other questions for me?
No, I don't think so.
Okay, well, Maria, it was very nice to meet you, and I wish you all the best, okay?
Well, thank you.
Okay.
Nice to meet you.
Okay, bye.